Fitness is first and foremost about feeling good and being able to move without pain. True fitness is about feeling healthy and being in sufficient shape to do the activities you want to do and live the lifestyle you want to live. Studies have shown that natural diet full of nutrients, regular exercise and meditation may help to increase your energy level, stronger immunity and sound sleep. These videos are about treating the common disease with healthy foods and exercises without medication. Heart attacks, also called myocardial infarctions, are very common. Chest pain is the most common warning sign of a heart attack. But there can be other symptoms like lightheadedness, nausea, shortness of breath and sweating. Symptoms can be severe or mild, and are often different from person to person. Some people may not even notice any warning signs of a heart attack. Heart disease is the leading cause of the death. It is also a major cause of disability. There are many things that can raise your risk for heart disease. They are called risk factors. Some of them are natural, you cannot control, but there are some risk factors that you can control yourself. Risk factors of heart attack that you cannot control. First is age. Your risk of heart disease increases as you get older. Men age 45 and older and women age 55 and older have a greater risk. Second is, in women heart attack risk is different from men. For example, estrogen and progesterone, female hormones, provides women some protection against heart disease, and women are less likely to have heart attack before menopause. Their chances of heart attack increases many folds after menopause. In men, diabetes raises the risk of heart attack. Third is family history. You have a greater risk if you have a close family member who had heart disease at an early age. Fortunately, there are many other risks that you can control to reduce your chances of getting heart attack. First is hypertension. High blood pressure is a major risk factor for heart disease. It is important to get your blood pressure checked regularly, at least once a year and more often if you have history of high blood pressure. Take steps, including diet and lifestyle changes, to prevent or control high blood pressure. Second is high cholesterol level, especially LDL and triglycerides. Under control, high levels of cholesterol can clog your arteries and raise your risk of coronary artery disease and heart attack. High fiber diet and regular physical exercise can lower your cholesterol. High levels of triglycerides may also raise the risk of coronary artery disease in women. Third risk factor of heart attack is overweight. Stay at a healthy weight. Being overweight or having obesity can increase your risk for heart disease. This is mostly because they are linked to other heart disease risk factors, including high blood cholesterol and triglyceride levels, high blood pressure, and diabetes. Controlling your weight can lower these risks. Fourth is wrong eating habits. Eat a healthy diet. Try to limit saturated fats, especially butter and cream, foods high in sodium, and added sugars. Eat plenty of fresh fruit, vegetables, and whole grains. Fifth is sedentary lifestyle. Do cardio exercises, walking, jogging, cycling, swimming. Exercise has many benefits, including strengthening your heart and improving your circulation. It can also help you to maintain a healthy weight and lower cholesterol and blood pressure. All of these can lower your risk of heart disease. Sixth is alcohol. Limit alcohol intake. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Both of these raise your risk of heart disease. Men should have no more than 2 alcoholic drinks per day, and women should not have more than 1. Seventh risk factor of heart attack is smoking. Don't smoke. Cigarette smoking raises your blood pressure and puts you at higher risk for heart attack and stroke. Eighth is stress and worry. Manage stress. Stress is linked to heart disease in many ways. It can raise your blood pressure. Extreme stress can be a trigger for a heart attack. There are ways to manage your stress include regular exercise, listening to music, focusing on something calm or peaceful, and meditating. Ninth is uncontrolled diabetes. Manage diabetes. Having diabetes doubles your risk of heart disease. That is because over time with high blood sugar from diabetes can damage your blood vessels and the nerves that control your heart and blood vessel. So, it is important to get tested for diabetes, and keep it under control. 10th, that is last risk factor of heart attack is insomnia or sleeplessness. Make sure that you get enough sleep. If you don't get enough sleep, you raise your risk of high blood pressure, obesity, and diabetes. Most adults need 7 to 8 hours of sleep per night. Make sure that you have good sleep habits. Another problem related to sleeplessness is sleep apnea, causes people to briefly stop breathing many times during sleep. This interferes with your ability to get a good rest and can raise your risk of heart disease. These are 10 risk factors of heart attack that you can control to prevent heart attack. Your blood pressure is a certified indicator of your overall health. High blood pressure should never be ignored. It can lead to several complications like heart disease, retinopathy or eye disease, and chronic kidney disease. There are a number of ways to control high blood pressure naturally so that medicines can be avoided. First is lose weight. Weight loss is important part in reducing your blood pressure, especially people with obesity. People who with overweight can have 2 to 6-fold increase in risk of developing hypertension. Second is exercise. Regular exercise not only aids in weight loss but also helps in decrease of blood pressure. At least 30 minutes of moderate to intensity exercise each day should be done. Third is reduce the salt intake. Salt is enemy of high blood pressure. You may not be able to remove the salt completely from diet but avoid food very rich in salt. Fourth is avoid excess coffee. Drinking too much coffee or too many energy drinks that contain caffeine isn't recommended for people with hypertension. Fifth tip to reduce your blood pressure is to drink a lot of water. Stay hydrated is an important way to keep your blood pressure level in normal range. Sixth is to reduce alcohol intake. Studies have shown that 7 to 13 drinks a week can substantially increase the risk of hypertension. Alcohol can increase your weight and deplete the body of magnesium and potassium. Seventh point to reduce hypertension is eat foods that are rich in magnesium. Studies have shown that magnesium can reduce hypertension in small amount. Add high magnesium foods in diets such as green vegetable and unsalted almonds. Eighth is to avoid processed foods. A healthy diet plays an important role in reducing hypertension. Processed foods are loaded with sodium and saturated fat. These two things people with hypertension should be avoided. Ninth point to decrease your blood pressure is to reduce stress by using breathing exercises, practicing yoga, quality sleep, taking break throughout day and spending time in nature or listening to music. 10th is quit smoking. Smoking can lead to constriction of arteries acutely and long-term. It greatly contribute to development of high blood pressure. 11th point to reduce hypertension is eat dark chocolate. Studies have shown that people who didn't have hypertension and ate more dark chocolate had lower blood pressure than those who ate less dark chocolate. Last point to reduce your blood pressure is to take good quality sleep for minimum 8 hours. These are all 12 points you have to follow to reduce the blood pressure. If you have family history of high blood pressure, then you have to follow these points from younger age to avoid hypertension in later years. In this video I am going to explain about aging and how you can slow down the aging process and diseases related to it. There are some foods that are very helpful in ward off diseases that comes with aging. Fiber. Foods that are high in fiber, like fruits and vegetables, oats, nuts and legumes, can help with constipation that becomes more common as you age. They're also able to help lower your cholesterol levels, manage your blood sugar, and whole grains. They're a great source of fiber and rich in vitamin B, which you'll need more of as you age. Vitamin B6 and folate are key to keeping your brain healthy. Whole grains could also cut your chances of getting heart disease, cancer, and diabetes. Nuts. They are small, but very useful. Nuts like almonds, walnuts, cashews, and pistachios have big anti-aging powers. These crunchy snacks contain special nutrients that can help delay or prevent age-related heart disease, stroke, type 2 diabetes, nerve disease, and some types of cancer. Nuts also protect your brain as you age. Water. As you go up in years, not only does your body lose water, but your sense of thirst starts to fade. That means it will take you longer to know when you're low on fluids. Water is food for your health in lots of ways. It cushions your joints, helps control your body temperature, and elevate your mood and how well you focus in daily life. Make 8 to 10 glasses of water each day your goal. Fish. Fatty fish like salmon, tuna, herring, and farmed fish should be on your menu twice a week. The reason? They are high in omega-3 fatty acid that's good for your brain. Omega-3 fatty acid have been linked to Alzheimer's disease, and get enough of it, and you may improve your memory and ability to learn new things. If you don't eat or like fish, walnuts, flaxseed and chia seeds are also good sources of omega-3 fatty acid. Lean protein. Protein-rich foods fight the natural muscle loss that happens as you get older. Take as much as you can. Enjoy your protein in real food like eggs, lean meat, and dairy products instead of protein powders that may not give you as many nutrients. Dairy products. The calcium in dairy keeps your bones healthy. As you get older, it can also lower your risk of osteoporosis, colon cancer, and high blood pressure. After age 60, you'll need 1,200 milligrams of calcium every day, which you can get through fat-free and low-fat dairy products. Milk and cheese aren't your only options. You can still take calcium through things like yogurt, rice and soy drinks, fortified orange juice, and tofu. Blueberries. They're a tasty way to protect your brain as you age. Blueberries contain compounds that lower inflammation throughout your body. They are also tonic for your brain cells. Fresh blueberries are best. Watermelon, tomatoes, oranges, these fruits and veggies are rich in a natural compound called lycopene. Studies have shown that foods that have it could lower your risk of some types of cancer and may protect you against stroke also.
Different vegetables have different nutrients and different types of fibers, and all are important for management of type 2 diabetes. Non-starchy and high-fiber vegetables are very useful and help in controlling the blood sugar as they slow down The absorption of carbs that may have eaten with them. If you have diabetes or you are trying to control your sugar level, you should eat vegetables which are low in glycemic index and full vitamins, fibers and are antioxidants in nutrients. These won't spike your blood sugar. First vegetable which is very useful for diabetics is broccoli. It is low in calories and high in vitamin C, vitamin B and fibers. Adding this fiber-rich vegetable to your regular meal is a great way to stabilize blood sugar level. You will consume less calories while still feeling satisfied. Try adding broccoli to your dishes anywhere or can eat as a salads. Second vegetable for diabetics is cauliflower. It is rich in vitamin C, folates and fibers. The fibers keeps our digestive system moving and improves blood sugar levels. Third diabetics-friendly vegetable is asparagus. In just 1 cup you get 3 grams of fiber. Asparagus is delicious and versatile vegetable. Fourth vegetable is spinach. It is full of fibers and antioxidants such as vitamin A. 1 cup of raw vegetable contains only 1 gram of carbohydrates. It should be consumed as a salad or put in egg omelette or stir into soup, stew and stir fries. Fifth superfood vegetable for type 2 diabetes is tomato. It is high in antioxidants vitamin C and lycopene. Sliced as diced raw, tomato is a great way to brighten up your colorful salad. Sixth is cabbage. A cup of chopped green raw cabbage has only 5 grams of carbs. Eating this vegetable is an easy way to add vitamin C and vitamin K to your diabetic-friendly diet. Seventh vegetable for diabetics is cucumber. It has high water contents that helps to make you full and hydrated. Cucumber also reduces your blood sugar levels as it stimulates the beta cells in pancreas to produce insulin. It can be eaten raw as a part of salad or in form of pickle. Eighth is ladyfinger or okra. It is full of nutrients such as potassium, vitamin B, vitamin C, folic acid and calcium. Its high fiber content associated with managing diabetes. Dietary fiber intake promotes better glycemic control and insulin sensitivity. Ladyfingers can be taken for savory and gravy dishes. 10th vegetable for diabetics is onion, especially red onion. Studies have shown that there are multiple flavonoids present in onion that helps to keep the blood glucose level in control and also good health and immunity. Red onions are rich in fiber content and low in carbohydrates. Glycemic index of onion is very low. You can add onion to soups, stews, salads and sandwiches. Fatty liver is buildup of extra fat in liver cells. Fatty liver is common than ever. It affects 30 to 40% of people. It usually does not cause any symptoms initially, however is often detected by ultrasound, CT scan or MRI. One of the main recommendations to get rid of fat stored in liver is to lose weight. Lose weight. Roughly 5 to 10% of body weight might be enough to improve your fatty liver. Target a gradual weight loss. Losing 500 to 800 grams per week is sufficient, as rapid weight loss in fatty liver may increase inflammation and fibrosis in liver. Aerobic exercises also lead to significant reduction in fatty liver. And with vigorous intensity exercises like jogging, swimming, cycling, skipping possibly also helps in decreasing fat and inflammation in liver. Eat Mediterranean diet also helps to reduce the fat in liver. This nutrition plan emphasis on fruits, vegetables, whole grain, legumes, nuts, replacing butter with olive oil or canola oil, limiting red meat and replaces with fish and poultry. Drink coffee. Some studies have shown that 2 cups of coffee every day is very helpful in the reducing fatty liver. Deficiency in vitamin D is also associated with non-alcoholic fatty liver disease. It is reasonable to maintain vitamin D level in patients with non-alcoholic fatty liver and treat with vitamin D. Hypothyroidism is common condition where thyroid gland doesn't secrete enough thyroid hormone into bloodstream. This makes your metabolism slow. Hypothyroidism can make you feel tired, gain weight, constipation, having higher cholesterol. Feeling depressed, dry skin, undisturbed periods, puffiness of face, unable to tolerate cold temperatures, soreness throughout your body. These all symptoms are due to slow metabolism. The metabolism is system that your body processes and uses food and nutrients you consume into energy. The winning formula for maintaining weight is what you eat in terms of calories should equal the calories you use on daily basis. To reduce weight you have to reduce number of calories or increase your metabolic rate. By increasing your metabolic rate you will burn more calories more speedily and thus you will lose weight. Metabolism rate depends on genetic, but you can enhance metabolism rate by using simple steps or lifestyle changes. First is exercise. Both cardiovascular and strength training exercise are important for boosting your metabolism. Strength training exercise are like weight lifting and building muscles. Muscle cells are 8 to 10 times more metabolically active than fat cells. Muscles cell burn more calories than fat cells. Cardiovascular exercises like walking, jogging, skipping, biking, running, and aerobics are very useful in boosting the metabolism rate. High-intensity cardio exercise is most effective in improving metabolic rate than low-intensity exercises. Second step to increase metabolism rate is to avoid skipping meals and starvation. Starvation is well-known cause of slow metabolism. Therefore sign and symptoms of starvation can also look like hypothyroidism. If you have been eating a low-calorie diet and experiencing symptoms of slow metabolism like fatigue, go back to normal eating. Third is stay hydrated. Water increases the energy you burn at rest by 30% because your body needs enough water to work well. That's why you need 2 to 3 liters of water per day. Fourth point to boost your metabolic rate is to get enough sleep. Not getting enough sleep lower your metabolic rate. 7 to 8 hours of sleep is enough. Fourth point to increase metabolism is to eat protein-rich foods. Eating protein increase metabolic rate by 20 to 30% as compared to carbohydrates and fats. Eating protein has been shown to help you feel full early and prevent you from overeating. Fifth is to drink green tea. Green tea has been shown to increase metabolism by 4 to 5%. These teas help to convert some of fat stored in body into free fatty acids. Sixth point to increase metabolic rate is spicy food. Pepper contains capsaicin, a substance that boosts your metabolism. Eating pepper would burn around 10 additional calories per meal. Sixth thing that can boost your metabolic rate is coffee. It boosts metabolic rate by 3 to 11% and promotes fat burn speedily. Seventh is to cut down the consumption of refined flour or maida. It is depleted in nutrition and contains harmful additives. Pasta, bread, pizza should be avoided to increase metabolism. 8. To increase metabolism is avoid foods which have pesticides that can lead slow metabolism. 9th is to cut down the consumption of fruits juice and soda drinks. They not only reduces your metabolic rate but you will also burn fewer calories and add to your fat store. 10th, that is last point to increase your metabolism is to avoid junk foods like noodles, muffins, French fries, chips. They are high in calories and low in nutrients. Having higher metabolic rate can helps you to lose weight easily and gain energy level. In this video I am going to explain you about bloating or distension of abdomen and how to prevent and reduce it. Bloating is distension or expanding of stomach. This is uncomfortable feelings of fullness or tightness and make your stomach appear larger. Stomach tissues are stretchy. If you put more into your stomach it can easily handle at one time but it may bloat. Eating too fast or quickly can cause swallowing of lot of air which can lead to bloating. Abdomen bloating will continue until food is digested. Slow down and enjoy each meal. Don't gulp it down. Chew your food carefully as digestion of carbohydrates starts in mouth. Avoid lying down immediately after meal. Stop chewing gum as lot of air goes into stomach. Avoid carbonated drinks, drink plenty of water. A glass of hot lemon water in morning is very helpful and prevent gas and bloating. Anxiety can also cause you to swallow more air. When you are anxious you breathe quickly and more air enter into your body. Taking a walk can sometimes be all that you needed to relieve gas and bloating. At least 30 minutes of exercise 3 to 4 times weekly will be plenty to help you to keep bloating or distension at bay. Yoga is another option if you have space and privacy. Several yoga asanas such as child pose or bal asana and happy baby or anand bal asana are very useful for bloating. Deep breathing exercise if done regularly is very effective in bloating and distension of abdomen. If you are very uncomfortable from gas in abdomen then lie on sofa, bed or floor on your left side. This simple move may work especially for relieving gas trapped in lower intestine. Try your hands to pull your knees close to chest if you can do comfortably or without causing more pain. Apply heat on abdomen with heating pad or hot water bottle. Heat can be very emotionally soothing. Heat helps to relax the muscles in your gut and relieve pain. Don't suppress passing of gas. If you feel distension or bloating from trapped gas, don't worry about modesty, instead go to private place and let out big bust or find a bathroom and relieve yourself. The less gas in your system, less likely it will cause you discomfort or pain. If bloating or distension is severe and intolerable then chew fennel seeds or south to release the gas. 1 teaspoonful is enough. Lycopodium 30 homeopathic medicine is very useful and effective in curing the bloating of abdomen. 4 to 5 drops of Lycopodium 30 can be taken in 1 teaspoon of water. It can be repeated every 10 minutes until bloating is relieved. These are some tips and medicine to reduce discomfort and pain caused by bloating or distension of abdomen. Depression is mood disorder in which person is feeling sad, irritable, empty and loss of pleasure or interest in activities for most of day nearly every day for at least 1 month. Several other symptoms like poor concentration, feeling of guilt, or low self-esteem, hopelessness about future, thoughts about dying or suicide, disruption of sleep, change in appetite or weight and feeling tired or low energy. It is important to realize that feelings down and depressed at times a normal part of life. Sadness and upsetting events happen to everyone. If you are feeling down or hopelessness on a regular basis, you could be suffering from depression. There are a number of things people can do to reduce symptoms of depression. First is exercise regularly is one of the best thing you can do for your mental health. Exercise, especially vigorous exercise, increases blood circulation of brain that reduces the stress and anxiety which are main causes of depression. Aim for 30 minutes of physical activity like jogging, swimming, cycling, climbing, skipping for 3 to 5 days a week. Exercise will increase your endorphin levels, which elevates mood. Second is to build strong relationships. Having strong relationships and active social life is very important in reducing your depression. Make sure you are constantly connecting with friends, relatives and loved ones, even when your lives are busy. Talk to them on phone or video call them. Third thing you can do to reduce depression is get plenty of sleep. High quality of sleep is necessary for physical and mental health. People with insomnia have tenfold of developing depression. For sleeplessness, do physical exercise, avoid caffeinated drinks in evening, have comfortable mattress, do meditation before sleep. Fourth thing to reduce depression is to stay away from toxic people. We all have met people who just make us feel bad about ourselves. They can lower your self-esteem, so avoid them. Fifth thing for depression is to do something you enjoy. Try to push yourself. You love something that's relaxing and energizing. It might be painting, gardening, biking, cycling. These activities will lift your mood and helps to overcome depressing thoughts. Music can be great booster of your mood. Nature, beauty have powerful influence on depression. Enjoy the cool breeze, chirping of birds, water springs sound, falling of leaves. These will surely elevate your mood. Exposure to natural sunlight has positive effects on mind and increases your energy level that helps you to overcome the depressing thoughts. Sixth thing to come out of depression is volunteering. Doing some things for others or giving your time to someone or help friends and relatives and reaching out may actually boosts your mood and energy. Seventh step to come out of depression is meditation and yoga. Stress and anxiety can prolong your depression symptoms. Try to do meditation. Start from 5 minutes. It will relax and calm your mind. Your mental health will be improved. Eighth is Mediterranean diet. Eat diet rich in vegetables, whole grains, legumes and fruits, nuts and seeds. Avoid coffee, caffeine and alcohol. Researchers have established that drinking alcohol can make symptoms of depression worse. Ninth is cut back on social media time. Increased social media usage also contribute to depression and low self-esteem. Limit social media time will help to prevent depression and you will get extra time to enjoy the life. 10th, that is last thing to lift your mood is to try something new. New things will improve your mental well-beingness and strengthen your social relationships. Consider trying new sport or taking creative class. PCOD or PCOS is a medical condition in which female hormones level estrogen and progesterone become imbalanced and affect the functioning of ovaries. As a result, monthly ovulation may not happen because ovaries fall to release mature egg, thereby disturbing the menstrual cycle. A lot of young girls, women suffering from PCOD, and like most diseases, PCOD is caused by certain foods and lifestyle disorders. So best treatment should be to avoiding foods that causes the PCOD and not through Birth control pills. First food that is to be avoided is refined processed flour or maida and products made from it such as pizza, burger, pasta, white bread, noodles, pancakes. These foods make PCOD worse and should be avoided completely from your diet. Second is saturated fat. Avoid butter, cream, pastries, beef, lamb, pork, cheese, ice cream, coconut, palm oil, fried foods. Third food which is to be avoided and stay away from these foods if you are suffering from PCOD is starchy foods and products made from them like sweet potato, corn, peas, rice, cornmeal, millet flour, oats and corn. Fourth is processed fruit concentrates and canned fruits should be eliminated from PCOD diet chart as they contain high doses of added sugar. However, fresh juice with fiber and pulp have beneficial effects. Fifth, foods which have to be excluded from diet are sugary foods and desserts like gulab jamun, gajar ka halwa, kheer and kulfi. They are all high in calories and loaded with large amount of sugar that adversely affect the PCOD. Sixth, foods which are very harmful from PCOD are dairy products. Dairy products are laced with hormones and antibiotics that are commonly fed to animals. They interfere with the hormones of women and make it difficult to cure PCOD. Seventh is red meat. Women with PCOD should limit red meat consumption such as pork, beef and mutton. These foods can aggravate to existing hormone problem as they are high in cholesterol and saturated fat. Various other foods like sausages, bacon, ham and salami should be excluded from diet. Eighth is fried foods such as samosas, pakoras and friller. They are high in saturated and hydrogenated fat and are unhealthy for PCOD. Ninth is alcohol and coffee can be a problem for women with PCOD. These stimulants kick in stress hormone in turn spike up insulin levels that has negative effect on PCOD. 10th, foods which are to be avoided in PCOD is soy products. They contain goitrogenic compounds that negatively impact the function of thyroid gland. This aggravate the symptoms of PCOD. Vitamin D deficiency means that you don't have enough vitamin D in your body. It can be very difficult to notice that you are deficient in vitamin D because symptoms may not occur for several months, sometime you may not get any symptom. One of the most important role of vitamin D is supporting immune system of body which helps you to ward off viruses and bacteria that causes illness. If you are deficient in vitamin D, you will often fall sick, especially cold, flu and respiratory infections such as bronchitis and pneumonia. Fatigue and tiredness can be caused by number of factors, but vitamin D deficiency is one of them. Studies have shown that children who have low vitamin D level are lethargic and have poor quality sleep. Joint pains and lower back pain are often caused by vitamin D deficiency. Vitamin D helps to maintain bone strength by absorption of calcium. People with arthritis, muscle pain and chronic joint pains tend to have low vitamin D level. Vitamin D deficiency causes slow wound healing after surgeries or injuries. Vitamin D has important role in controlling inflammation and infection by proper healing. Low bone density is indicative that your bones have lost calcium and minerals that are all due to low vitamin D level. This means that older people, especially women, are at greater risk of fracture. Muscle pain. The causes of muscle pains are often difficult to pinpoint, however studies have shown that vitamin D deficiency is potential cause. It is estimated that 71% with chronic pain were found to have deficiency of vitamin D. Obesity is one of the risk factor for vitamin D deficiency. Researchers found possible link between low vitamin D level and increased body weight or belly fat. These effects are more pronounced in men. Severe hair loss, especially in women, are often caused by vitamin D deficiency. Another symptom caused by vitamin D deficiency is anxiety. Studies have shown that adequate vitamin D level helps to reduce anxiety symptoms and improve quality of sleep. Vitamin D is very important for maintaining healthy bones by absorption of calcium. It prevents rickets in children and osteoporosis in old people. That's why level of vitamin D should be maintained by exposure to sunlight. And food sources such as eggs, fortified milk, oranges, juice and fatty fish like sardines, salmon, etc.
There are many sayings, myths and recommendations about how we should eat our food. Most mothers tell children not to gobble their food but to eat more slowly because eating fast really related to weight gain and obesity, and there is truth in old saying that chewing your food 32 times will make you lose weight. Chewing food slowly has been a strategy for weight management for decades. Originally it was based on ideas emanating from medicine. People eat their food quickly and carelessly. This may lead to weight gain and other health issues. Eating slowly may be a much smarter approach, as it could provide a number of benefits. Stomach requires the food to be thoroughly disintegrated by the teeth, and steeped in saliva, to work properly, and that everyone knows that food should be chewed properly. When you eat, you chew food into smaller particles and mix it with saliva in the mouth. Saliva starts the process of digestion and the breaking down of food. This continues in the stomach, where it is mixed with acid. The broken down components are then moved along the gut, with nutrients and water being absorbed along the way, and the undigested portion of fibers and partly digested foods passes out of the body. Chewing food well allows this process to start properly and continue well. Too fast can cause weight gain. People who eat quickly tend to weigh more than those who don't. In fact, fast eaters are up to 100% more likely to be obese than slower eaters. They also tend to gain weight over time, which may be partially due to eating too fast. Studies have shown that those who said they ate very fast tended to be heavier and had gained the most body weight since age 20. Your appetite and calorie intake is largely controlled by hormones. After a meal, your gut suppresses a hormone, which controls hunger, while also releasing fullness hormones. These hormones tell your brain that you have eaten, and reduces the appetite, making you feel full, and helping you stop eating. This process takes about 20 minutes, so slowing down gives your brain the time it needs to receive these signals. Eating too quickly often leads to overeating, as your brain doesn't have enough time to receive fullness signals. Additionally, eating slowly has been shown to decrease the amount of food consumed during the meal due to an increase in fullness hormones. Eating slowly can decrease calorie intake. Eating slowly promotes thorough chewing. To eat slowly, you need to chew your food thoroughly before swallowing. This can help you reduce calorie intake and lose weight. In fact, several studies have found that people with weight problems tend to chew their food. Consume a bit of water prior to eating your meal and also consuming a bit of fiber with your meal. This should make you feel fuller and therefore make you eat a bit less. In addition to chewing your food completely, there are other ways to improve your digestion and reduce the risk of constipation and bloating. For this, you should avoid drinking water or beverages in between the meals. Too much liquid in the stomach will slow down digestion. You should concentrate on the meals while eating. For instance, avoid distractions such as television, talking, or eating on the run so that you are calm and focused during the meal. This also makes the meal more enjoyable. Make sure you chew the tiniest piece possible. If you can still feel parts of the food in your mouth, this means you have not chewed it properly. In addition, you should chew slowly and steadily. Chew until your mouthful of food is liquefied or lost all of its texture. Finish chewing and swallowing completely before taking another bite of food. Wait to drink fluids until you've swallowed. If you're a fast and furious eater, work on being mentally present while eating so you can truly enjoy your food. Eating slowly may also improve your health and quality of life in other ways, including increasing your enjoyment of food and improve your digestion. It also helps you to absorb more nutrients and making you feel calmer and reducing your levels of stress. So in future, always eat slowly and enjoy the meal.
High-density lipoproteins HDL is one of two types of cholesterol you will find on lipid profile test results that screen for your risk of cardiovascular disease. The other is low-density lipoproteins, that is LDL. HDL cholesterol is gooder or helpful cholesterol and LDL is lousy and less desirable cholesterol, so they are different. To understand good cholesterol, you have to learn about bad cholesterol, that is LDL. LDL causes a plaque buildup in your blood vessels. These fatty deposits reduces or block the flow of blood and oxygen. Over time, that junk on your arterial wall can lead to heart attack or stroke. So what does HDL do basically? It works in your bloodstream like scavenger or cleaner. The good cholesterol removes the bad cholesterol from your blood, taking to liver to be excreted. When your HDL level dips below 40 mg per deciliter, your risk of heart disease rises. It is also crucial to keep your LDL level below 100 from early age. There are few lifestyle changes to boost HDL and reduce your LDL level. Adopt a healthy lifestyle, that is, eat ample amounts of fruits and vegetables. Foods higher in soluble fiber such as oats, whole grain cereals and legumes should be taken to boost your HDL level. Fish rich in source of omega-3 fatty acid is to be added in diet. Animal fat and other saturated fat can send LDL level soaring. That's why it is good idea to avoid them. Full cream dairy products like whole milk, butter and sour cream should be avoided. Egg yolk is not recommended. Eat only white of egg. Avoid fried food, fast food and tropical oils such as palm oil, coconut oil. Physical activity is very effective in increasing the HDL. Numerous studies shown that moderate to high-intensity exercise can boost your all-important HDL number, and as an added bonus, working out pushes your LDL number down. Try walking, running, biking, swimming or weight training exercises. Set a goal at least 150 minutes of moderate to intensity physical activity per week or 75 minutes of vigorous intensity exercise. Lose extra weight. Carrying extra kilo increases your LDL cholesterol number and pushes down your HDL cholesterol. A weight loss of 5 to 10% can improve your cholesterol levels. Don't smoke. Smoking drives down HDL level while increases your risk of coronary heart disease, high blood pressure and stroke. Manage your blood sugar levels. Researches have shown that cholesterol often go hand in hand with the blood sugar level, especially in type 2 diabetes. If your blood sugar level is on higher side, then cholesterol will also be high, especially bad cholesterol, that is LDL. So healthy diet, regular exercise and controlling your weight are all key to manage your good cholesterol, that is HDL. Thanks for watching the video. Please like, comment and subscribe the video.